You know, March is Colorectal Cancer Detection and Treatment Month, and we decided we'd come over and talk to some of the folks that are dealing with that. That's at the Singing River Health System over in Ocean Springs. Of course, we're talking to one of their physicians, internal medicine physicians, Dr. Priyanka Srivastav. How are you?
I'm good, thank you. Thank you for the introduction.
Well, thank you. Tell us a little bit about yourself.
My name is Priyanka Srivastav. I'm originally from Nepal, and I moved to the United States almost close to 8 years now. I got trained in internal medicine at upstate New York, and then I moved to this area with my husband, who's a pulmonologist. Now we have a 6-month-old boy.
Oh, wonderful.
Thank you. And I have been working as a primary care physician with Singing River for almost close to 3 years now.
When should someone start working and building a relationship with a primary care doctor?
I would say now. Everyone should have primary care physician all the time. Even if you don't have any health issues, you should establish with a primary care physician because you need to follow through screening measures such as vaccinations and screening procedures. If you do have chronic health issues, you need a primary care physician for treatment, for referral to appropriate specialists when needed, for coordination of care, and for overall management.
And proper treatment and early detection can really lead to save your life in a lot of situations. Colorectal cancer, second leading cause of cancer deaths in the United States. How is Singing River working to combat this?
We are recommending everybody to get screened when they're eligible. The survival rate of colorectal cancer is 90% when it is detected at an early stage. And if it spreads to other parts of your body, that survival rate of 90% comes down to almost 15%.
Wow, that's a dramatic drop. Now, who is eligible to be screened?
American Cancer Society recommends anyone who is at the age of 45 with an average risk. Now, when I say average risk, that includes anybody who does not have any family history of colon cancer in first-degree relative, no personal history of colon polyps, no history of any gastrointestinal disorders like ulcerative colitis or Crohn's disease. So anyone who falls into that category can also have a screening test done at home.
Okay. Now, when as far as screening, going to the doctor, a colonoscopy, when's is there a particular age when we should start getting that done on a regular basis? Well, I think once every 10 years or something.
Yeah, it all depends on, it starts at 45 years of age, but this is different in somebody who has, a family history of colon cancer.
Right.
Then you need to talk to your provider about it. But if the colonoscopy comes clean, there's no polyp, it's every 10 years for sure, yes.
Okay, and if something comes back abnormal, what
then
happens?
You are referred to a GI physician.
Now, if someone wants to make an appointment with you, what do they do?
Well, they call us on at our clinic on the phone number 228-872-2403 or visit us online at singingriverhealthsystem.com.
And of course, we want to reiterate the importance of early detection, early screenings. I mean, it could mean the difference between life and death.
Yes.
I mean, you could look perfectly healthy and still have issues.
Yeah, absolutely. So screening is very important. I come from a country where a health screening is not as much as available as it is here. So I understand the importance of it because healthcare screening increases the life expectancy. So screening is also very safe, affordable. It decreases the overall mortality, and it also decreases the overall healthcare cost, and at the end of the day, it saves lives.
Definitely. Dr. Srivastav, thank you so much. We're going to talk to Dr. McNeese now about regional digestive. Joining us now, gastroenterologist Dr. Trip McNeese with the regional digestive specialist. How are you?
I'm well, thanks, Jim.
So you've had a patient referred to you from Dr. Srivastav. What now?
Well, we typically see them in clinic and make sure that everything's medically stable for them to undergo a colonoscopy. And we schedule them for a colonoscopy on a date of their choosing, whatever works best with their schedule.
And of course, I can remember doing the prep stuff for the colonoscopy. It's not a fun thing, but it's necessary.
Absolutely. The quality of the prep is directly proportional to the quality of the scope. You know, you can only diagnose what you can see.
Right.
So that is probably one of the most important things, is to have a good prep.
Okay. How common is colon or colorectal cancer?
Typically, there are about 150,000 diagnosed a year, and probably about 4% over a lifetime risk for men and women.
So it's very important to get that early screening done.
Absolutely. This is the second most common cancer affecting both men and women.
So you might have to tune into a later date, because it's been about 12 years since I've had one, and Dr. McNeese has already told me I'm due. So that'll be for later. What are some of the risk factors for someone getting colon cancer?
Well, it's definitely age. So screening typically starts at 50, but there have been studies wanting earlier screenings at age 45, particularly in African Americans. A history of colon polyps, family history of colon cancer, as well as there's some dietary risks, increased red meat, obesity, smoking, increased alcohol use are all risk factors.
How does it start?
Typically, colon cancer starts as a colon polyp, and it typically takes 7 to 10 years for an adenomatous polyp to become a cancer. Hence, when you have a normal colonoscopy, you have another one in 10 years from that.
Right.
But there are other different types of polyps.
Are there any particular symptoms?
Not necessarily.
Really?
We find cancers on screening colonoscopies, and that's why we do it. It's a preventative test, just like your mammograms, your pap smears, your prostate exams, and an ounce of prevention is worth a pound of cure.
Can it be prevented?
Absolutely. So when we do a colonoscopy, we take out any polyp that we see, and if you have a colonoscopy and a polyp removed, you have a 53% less chance of developing colon cancer.
What kind of treatments are there for colon cancer?
Typically, if I find a colon cancer, we'll do CT scans to make sure there's nothing anywhere else in any other organs. The patient will undergo surgery, and at that point in time, the piece of colon and the cancer are removed along with lymph nodes, and depending on the lymph nodes, if it's positive in the lymph nodes, determines what stage the cancer is.
Dr. McNeese, thank you so much for your time. If you'd like to make an
Absolutely.
appointment, 875-3033, or you can visit SingingRiverHealthSystem.com, make an appointment. Very important to do. Get your screening early and, prevent something serious from happening.